What exactly is a peptic ulcer? Well, a peptic ulcer is an open sore that develops on the inside lining of your stomach and the upper portion of your small intestine. When the ulcer is in the stomach, it's called a gastric ulcer. If it's in the first part of the small intestine, the duodenum, it's known as a duodenal ulcer. Our stomachs have a pretty amazing natural defense system. A thick layer of mucus and bicarbonate acts as a shield, neutralizing the strong acid our stomach produces to digest food. But what happens when this protective layer is damaged? Several factors can weaken this shield, leading to the formation of an ulcer. Let's look at the main culprits. First up, we have certain medications. The most common offenders are non-steroidal anti-inflammatory drugs, or NSAIDs, like ibuprofen and naproxen. Corticosteroids can also contribute to the problem. Next, and this is a big one, is a type of bacteria called Helicobacter pylori, or H. pylori for short. This bacteria can live in the stomach and cause inflammation, breaking down the protective lining. I have a separate video all about H. pylori, so be sure to check that out for a deeper dive. Then there are factors that can increase stomach acid production. These include lifestyle factors like smoking, excessive alcohol and caffeine intake, and even high levels of stress. Now, how would you know if you might have a peptic ulcer? The most common symptom is a burning or gnawing pain in the upper part of your abdomen, in the epigastric region. You might also experience nausea and sometimes vomiting. In some cases, a peptic ulcer can lead to more serious symptoms, especially if it causes bleeding in the upper gastrointestinal tract. This can present as hematemesis, which is vomiting blood, or what's often described as coffee ground vomiting. Another sign is melena, which are black, tarry stools caused by digested blood. Here's a quick and interesting point. For some people, eating can make the pain of a gastric ulcer worse, as food stimulates acid production. Conversely, for a duodenal ulcer, eating can sometimes temporarily relieve the pain, as the food buffers the acid. So how do we investigate a suspected peptic ulcer? According to NICE guidelines, if you're under 55 and have epigastric pain but no alarm features, the first step is usually to test for H. pylori. This can be done with a simple stool antigen test or a urea breath test. However, if a patient is over 55 or has any of the following alarm features, a more urgent approach is needed. These alarm features include progressive difficulty swallowing, also known as dysphagia, unintentional weight loss, persistent vomiting, an iron deficiency anemia or low hemoglobin, an epigastric mass that can be felt, jaundice, unexplained dyspepsia in someone over 55. If any of these are present, an urgent referral for an endoscopy is necessary to get a direct look at the stomach and duodenum and to rule out other serious conditions like stomach cancer. If left untreated, peptic ulcers can lead to some serious complications. Bleeding. As we've mentioned, this is a significant risk. Perforation. This is where the ulcer creates a hole in the wall of the stomach or duodenum. This is a surgical emergency, causing sudden, severe abdominal pain. Gastric outlet obstruction. This is a narrowing of the pylorus, the opening from the stomach into the small intestine, due to scarring. This can cause persistent nausea, vomiting, and a feeling of fullness after eating. Now for the good news, peptic ulcers are treatable. The treatment really depends on the cause. If an H. pylori infection is found, the primary treatment is a course of antibiotics to eradicate the bacteria. This is often given along with a proton pump inhibitor, or PPI, to reduce stomach acid. If the ulcer is caused by NSAID use, the first step is to stop the medication if possible. A full-dose PPI will likely be prescribed for up to 8 weeks to allow the ulcer to heal. Lifestyle advice is also crucial, so avoiding foods that trigger your pain, quitting smoking, and reducing alcohol and caffeine intake can all make a big difference. And that's a wrap on our summary of peptic ulcer disease. I hope you found this video helpful and informative. If you did, please give it a thumbs up, and don't forget to subscribe to the channel for more medical summaries. As always, thanks for watching.